UAB Hospital's Chief of Hospital Medicine, Dr. Kierstin Kennedy, shared some information about firsthand experience treating patients with COVID-19. WVUA 23's Ajane Robinson spoke with her via Zoom today. She's live with more.
Lynn, Dr. Kennedy and her team take care of the patients before they enter the intensive care units and after they recover and come out of the ICU as well. They are ultimately the entry point for many COVID-19 patients and are trying very hard to keep the patients well enough so that they keep them out of the intensive care units. However, the time period of COVID patients entering the hospital and then being admitted into the ICU is getting shorter and shorter due to patients simply getting sicker and not having more needs that can't always be provided on an acute care level. Dr. Kennedy says this has become very hard for physicians and trained providers.
In general, I find caring for COVID patients to be, in some ways, it's heartbreaking. Not only because you just don't know which patients are going to do well and which ones will not. As we practice more and more, you start to get sort of a clinical, gestalt of what a patient looks like that is going to end up doing poorly and what one that's ultimately going to do well looks like. But you don't have any, we don't have studies to back that up. It's just it's just sort of a gut feeling that's, I guess, some of the art of medicine.
Dr. Kennedy said she does feel for the COVID patients as well because they are isolated and unable to get that human connection from a family member or a friend. Coming up at 6, we'll hear more from Dr. Kennedy about hospital capacity and ICU beds. Reporting live, I'm Ajane Robinson, WVUA 23 News.